Bismillahirrahmanirrahim. Assalamu alaikum. I am homeopathic Dr. Muhammad Ayub Alam from Chanawala. And today I talk to you about angina. So let's start. Angina is a type of chest pain caused by reduced blood flow to the heart. Angina is a symptom of coronary artery disease. Angina also is called angina pectoris. Types of angina: stable angina, triggered by physical exertion or emotional stress, goes away with rest or medication. Unstable angina can occur at rest, sudden more severe and lasts longer. A medical emergency may indicate a coming of heart attack. Variant angina, caused by a spasm in coronary arteries, often occurs at night or during rest. Less common symptoms of angina: chest pain or pressure, pain radiating to arm, jaw, neck, shoulder or back, sweating, dizziness, vertigo, nausea and vomiting, shortness of breath. Diagnosis of angina: electrocardiogram, echocardiogram, stress test, coronary angiography, troponin 1 or T test. Allopathic treatment of angina: nitrates, nitroglycerin, beta blockers, calcium channel blockers, antiplatelet drugs, aspirin, clopidogrel, statin for cholesterol, angioplasty plus stent, coronary artery bypass, graft. Homeopathic treatment: cactus, spigelia, glonine, digitalis, aromat or cratagus. Change lifestyle: quiet smoking, exercise regularly, control blood pressure, diabetes or cholesterol. Eat a heart healthy diet, low salt, low fat. Thank you for watching.